I'm Dr. A.S. Soin, Chairman and Chief Liver Transplant and Hepatobiliary Surgeon at Medanta Liver Institute in Gurgaon, Delhi NCR. I'm also the Director of the Jaslok Medanta Liver Transplant Program here in Mumbai.
Pleasure sitting with you, sir. Just wanted to understand from you, what is the level of organ donation awareness in India?
See, people in India are becoming more aware of organ donation and the benefits of it and what the procedure of organ donation is. So basically what we're talking about is two kinds of organ donation. One is live donation, the other is deceased donor donation or cadaver donation. Live donation means that for kidney transplantation, a family member of the patient can donate one kidney, which is totally safe. And for liver transplantation, the family member can donate 1/2 of their liver, which is also completely safe because the remaining liver in the donor grows back to normal size in about 2 months. So the liver has this amazing quality of regeneration, because of which the original size of the liver is restored and the donor does not come to any harm at all. Now, looking at cadaver donation or deceased donor donation, it basically means that if and when a person has got a brain injury from a road accident or a brain hemorrhage or a stroke and is in ICU, and despite doctors' efforts, the brain does not recover but the other organs are maintained well on life support systems. If the families of such people agree for organ donation, then before discontinuing ventilator and life support, these people can donate organs and save up to 7 or 8 lives. A single person donating organs can save up to 7 or 8 lives and influence another 15 to 20 people to improve their life quality. So such is the huge benefit of organ donation to society, and more people are recognizing this, but I think there is a long way to go in India for this awareness to spread to everyone. So now what has happened is that the government has mandated the inclusion of the concept of organ donation in school curriculum, so that people early on in school and college understand the benefits and the procedure of organ donation, so that in the next 10-15 years, everyone in society will have heard of organ donation. The awareness has gone up, I would say 3 to 5 times in the last 5 years, but still in a large country like India, we are 1.3 billion population. We only have about 500 cadaver donors every year, whereas a country like India should have about 50,000. So like what, 1,000 times or 100 times that number should be the organ donation rate.
If we talk about transplants, especially liver transplant, then how complex these surgeries are?
So liver transplant surgery is probably among the most complex surgery in the entire textbook of surgery. That's because it needs long years to train and become an expert in liver transplantation for the surgeons. But the other thing with liver transplantation is that the liver is like the hub in the body, which is a factory that manufactures proteins, it manufactures blood clotting products, hormones. It is also like a cleansing organ of the body that it detoxifies substances. So liver function and dysfunction influences the entire body. So operating on the liver is like it affects all the systems, and that's why it's very complex. The other reason is that it needs a big team of surgeons, anesthetists, intensivists, hepatologists, dietitians, heart specialists, and even kidney specialists, dialysis, a good blood bank or transfusion services. So it needs the support of a lot of other specialties, and that's why liver transplantation is tough to develop as a specialty in a hospital. So not only the surgery is complex, but getting the team of experts together is also a complex affair. And that is why you find that there are very few centers in this country and generally in the world that do a large number of transplants. But the Medanta system, which I'm the chairman of, and which includes Jaslok Hospital, we do approximately 300 liver transplants a year with 95% success rate.
So how about the risk involved and survival rate?
So, you see, liver transplantation is done on people who are dying of liver failure or liver cancer. That means if they didn't have the transplant, they would be dead in few weeks to few months. So if you do not do liver transplants, then 100 of these people will all die. And if you do liver transplantation in the modern era, in our system at Medanta and Jaslok, we are able to save 95% of these patients. There is 5% risk to life, but if you don't do liver transplant for a liver failure patient, there is 100% risk to life.
So what kind of lifestyle alterations are required to be made by patients if they go for liver transplant?
When somebody has a liver transplant, that means they have to have a foreign organ in their body. So the body tends to reject anything that is foreign that is put into the body. And to prevent this rejection, there are some anti-rejection medicines that are needed by these patients. So after transplant, these patients are put on anti-rejection medicines and some preventative antibiotics and antifungal medicines. So total number of medicines after discharge, after a transplant, typically are about 9 to 10. But then over the next 2 or 3 months after liver transplant, the number of medicines comes down to about 2. And after about a year, the number of medicines that the patient has to take is only one single medicine through their life. In the first 2 or 3 months, they have a little increased risk of infection, so they have to be a little careful with water, with food, with hygiene. But it is not such a serious issue that the patient has to make an ICU at home. A lot of my patients ask me before the transplant that what will happen after transplant. You know, will I have to have a single room, which is like an ICU? So that is all a misconception. It's not that bad at all. It's just general personal hygiene precautions that have to be taken after transplant. The medicines have to be taken on time. The doctors have to be met with at the regular frequency that is advised. So after transplant, the change in the lifestyle and quality of life is only about 10%, and that also for the first 3-4 months. After that, the liver transplant patients have a totally normal existence and an excellent quality of life.
So according to you, is India a favorable destination for such complex surgeries, or can India become a medical tourism destination for patients?
You see, at the Medanta Liver Institute and in our system of hospitals, which include Jaslok Hospital, we do about 300 liver transplants a year, and we are possibly the world's second largest liver center. So we do a lot of liver transplants and our success rates are 95%. And what's more, we do it for about 1/10 to 1/20th the price that it is done in the US and the UK. So the obvious reason why foreigners would want to come to India for liver transplants is because the quality is very high, the success rates are very high, and the cost is very low. Of course, the cost of 20 to 25 lakhs is what it takes to have a liver transplant, and that is not easy to afford for a lot of people. But if you compare it with the cost of approximately $300,000 to $400,000 that it costs in Singapore and the US and Germany, etc., then the cost is very low. And that's the reason why there is this is a very favorite specialty where medical tourism is quite well developed and is actually climbing, because the success rates are high and the cost is low.